Yeah, look, and whether it's a vision problem is the tricky one, which is why we often say it's a hidden vision problem because it's not always something obvious like an eye turn or they're not seeing clearly. It's something else going on, and often the only way to really find them is to get a proper sort of full vision exam of all of their different sort of visual skills.
So what's the difference then between a quick sight test and a functional vision assessment?
Yeah, so everyone sort of often when you hear the word vision being used, often people are really meaning just sight, and sight is just a small part of the overall visual process. And sight is measured by when we look at the letter chart and work out whether you can see 20/20 or not, and whether a prescription restores you back to 20/20. And when we talk about functional vision, it's more about how have you learnt to move your eyes smoothly? How well do you coordinate your eye movements with your head movements and your body movements? How well do you coordinate the two eyes together and coordinate the focusing and all of that going on at the same time? And then once you're able to do that, are you able to do it automatically? And if you're able to do it automatically, then are you able to actually use the information that you're getting in through your visual sense to learn and move through the world and those sorts of things? So functional vision is those things around how well you're using your eyes as a tool for learning.
So is this why some children might say that reading is hard or tiring, even though they've been told that their eyesight's just fine?
Correct. And so, if you do screenings are great for picking up, obvious vision problems. Sorry, those rare but high refractive errors where one eye might be seeing clearly, but the other one's not, or some sort of eye turn. But they don't really delve into whether there's actually an issue with the coordination of the two eyes or a problem with focusing and those sorts of things.